The one thing I just wanted to start with was in terms of the Queen's Nursing Institute project approach. What they said was it needed to be an innovative project. And that actually seems very obvious in one respect, but it actually made us think in terms of how we actually change thinking and change behaviour to actually achieve something different to what's happened before. The issue of smoking is one of the hardest things to engage with any families, particularly those that are particularly hard to reach. And sometimes we've got all these messages nationally about stopping smoking is the only thing you can do. And this was about, well, actually, can we think about smoke-free homes as an interim option for those families that aren't going to stop smoking, but that actually we can do something a little bit more positive in terms of the health of their child. Briefly, I just want to touch on the smoking white paper that came out last year. It's not hugely different in the amount of time I've been in smoking cessation. Not much has actually shifted in terms of how we want to move the strategy forward. But smoke-free is becoming a real kind of focal point, particularly after the legislation in 2007. Smoke-free, again, it can be slightly contentious, particularly when you get to things like smoke-free open spaces, because you are significantly then limiting the areas that people can smoke. And whereas that's very good for a non-smoker, you have to balance that with actually not making smokers feel particularly persecuted. I'm just going to pass you over to Marilyn, because obviously, as Rosemary said, this is kind of a joint initiative between public health and the frontline nursing staff, of which Marilyn is the expert here. So she's going to give the context in terms of other policies.
Hello, hiya. Yes, I think that as a children's nurse, and obviously for a lot of you as healthcare professionals, the Every Child Matters framework is very, very pertinent to our work. And I think as part of the project about keeping the children healthy and safe, that really does embrace that. Children and young people learn and thrive when they are healthy, safe, and evidence shows that educational achievement is the most effective way of these children to sort of get out of poverty. And to be really fair, a lot of the children and the families that I did see, they were the ones that were more difficult to engage with and that were sort of less likely to want to engage with services. So obviously to keep them healthy was, the main outcome of the actual project. The government also recognises the crucial role of the parent and the carer and family in improving outcomes for children and young people, and the need to provide the support to the parents and the families in order for them to do that. So where did the project actually come from? How did it all actually begin right in the beginning? As Rosemary says, my nursing history, a large percentage of it has been actually on the wards in the acute setting. And what I used to find was that the children used to come into hospital. It's really quite distressing when you see the children and they're actually very short of breath. They're struggling to breathe. You're having to increase the treatment. Obviously with some of the respiratory conditions, it can be very life-threatening. And you were very aware that there was the smell of the second-hand smoke. It used to be on the children's hair and on the clothing. And at that time, there wasn't really any pathway of anybody to refer to other than smoking cessation. And quite a lot of these families just weren't interested. I was lucky to get a community post about 6 years ago, there again engaging with children that had actually been in hospital and then were referred to my service in the community for support and additional assessment. And it was, you're actually you're in a prime area, you're actually in the children and the family's home, and I'm sure that you'll agree. Part of the assessment, it was around allergen avoidance, it was around potential triggers, and it was very evident from a big percentage of the families that second-hand tobacco smoke was certainly a contributory factor to the children's respiratory wheeze. And also I was seeing children that were actually premature and that were actually in the home on home oxygen. So the home visits created this contact. I used to come back and discuss it with my manager, felt really frustrated that there wasn't anything that we could do. As a part of that discussion with my manager, we got in touch with Public Health. We put in our application to the Q&I for funding, and we wanted to employ a smoke-free home worker who could go out and support these families. So, as I say, we knew about the Queen's Nursing Institute newsletter. We put the application in, and we were lucky to get the funding for the project.